There is one activity shown in research to reduce your risk of dementia by as much as 76%. Not running, not swimming, not lifting weights, not crossword puzzles. Something most people have written off as entertainment. And the reason it works goes all the way down to your neuroscience, your biochemistry, and the structural mechanics of your joints. By the time this video is over, you will understand what is happening inside your brain and body at a level most people never get, even from their own doctors. We are building toward 200,000 subscribers on this channel. If you are not subscribed yet, hit that button right now, because what I am about to tell you is the kind of information a system built on treating sickness has very little financial incentive to give you. Like, subscribe. Let's get into it. The activity is dancing. Stay with me. I am not giving you a feel-good pitch. I am walking you through the science the same way I would if you were sitting across from me in my clinic. A study referenced by researchers at Harvard Medical School compared how different activities affected dementia risk across aging populations. Here is what they found. Reading reduced dementia risk by 35%. Crossword puzzles reduced it by 47%. Regular aerobic exercise, walking, cycling, swimming showed almost no measurable effect on cognitive outcomes, almost none. And dancing reduced dementia risk by 76%. That is more than double the benefit of crossword puzzles. These are not fringe findings. They deserve to be part of every clinical conversation happening with patients over 50. And most of the time, they are not. To understand why that number is so high, you need to understand what is actually happening inside the brain when you dance. Most adults, after a certain age, stop introducing anything genuinely new into their physical lives. Same commute, same posture, same movements, repeated on autopilot day after day. There is a term for this in clinical neuroscience: motor monotony. Your nervous system stops receiving novel input. The neural pathways that depend on new signals begin to weaken. And here is the fundamental truth that most people have never been told directly. The brain is not a fixed storage unit. It is living tissue. It either builds new connections or it loses them. Novelty and complexity strengthen it. Repetition and autopilot quietly erode it. Now, when you learn a new dance movement, 6 distinct regions of the brain activate simultaneously. The basal ganglia, deep in the brain, learn and store movement sequences. This is where motor memory lives. The cerebellum at the back of the skull controls the smoothness and precision of movement. The kinesthetic cortex tracks where your body is positioned in space. The auditory cortex processes rhythm, tempo, and musical timing. The limbic system handles the emotional and social experience of moving. And the prefrontal cortex, your brain's executive planner, is making real-time decisions about what comes next. 6 regions, all firing at once. No other activity does this. Not chess, not yoga, not complex professional work. Dancing is the most cognitively demanding physical activity a human being can perform. The research is now solid on that point, and there is one principle here that most people miss entirely. The smoother you try to make a movement, the harder your cerebellum works. Not faster, not more complicated, smoother. When you pursue that slow, fluid, controlled quality of motion, the kind that looks effortless but is not, you are specifically training the cerebellum. And current research has expanded our understanding of what the cerebellum actually does. It participates in cognitive processing speed, in attention switching, and in emotional regulation. Every slow, deliberate movement you make in a dance session is a direct investment in the long-term sharpness of your mind. In 2026, researchers at Kyoto University published findings that matter enormously in clinical practice. They found that dancing is especially effective for people who are already noticing something is off, names they cannot retrieve, words that will not come, tasks they keep forgetting, but whose formal cognitive testing still comes back completely normal. That window has a clinical name: subjective cognitive decline. It is the transitional zone between normal aging and early dementia. It is also the moment when intervention actually works before damage becomes entrenched. I had a patient. I will call her Margaret. 64 years old, former journalist, sharp woman. She came in because for about 2 years she had been losing the thread of conversations, forgetting names she had known for decades. Her tests were clean. I told her what I am telling you now. 5 months later, she was back. She had started a beginner ballroom class 2 evenings a week at a local community center. That was the only change. She told me the mental fog had cleared. No new prescription, no expensive program, just dancing. Let me shift to what is happening below the neck, or starting with the spine. Your intervertebral discs, the cartilage pads sitting between each vertebra, have no blood supply of their own. None. They receive their nutrition entirely through diffusion. When movement compresses the disc, fluid gets pushed out. When the compression releases, fresh fluid is drawn back in, like a sponge being squeezed and released. Move your spine regularly, and your discs stay hydrated, nourished, and resilient. Sit motionless for hours every day, which is exactly what most adults do, and those discs slowly dehydrate, stiffen, and begin to break down. That is how disc herniations begin. That is how chronic back pain starts. Not from too much movement, from not enough. Picture a full body wave starting at the top of the cervical spine and rolling all the way down to the sacrum, each segment flexing and extending in sequence. You see this in West African dance, in hip-hop, in contemporary movement styles. That single movement pattern simultaneously mobilizes the cervical spine, the thoracic spine, and the lumbar spine. No single physical therapy modality addresses all 3 regions in one movement. Dancing does, and running parallel to the spine are the sympathetic nerve trunks, part of the autonomic nervous system that governs your heart, lungs, digestive tract, and hormonal signaling without conscious input. When the spine is chronically locked up and immobile, signal transmission through these trunks becomes sluggish. This is the clinical explanation for something I see constantly. Patients with chronic back pain who also have irritable bowel syndrome, intermittent cardiac arrhythmia, or hormonal irregularities. The spine is not just a structural column, it is a conductive highway. Restoring spinal mobility restores that conductivity. I want to address a myth I hear at least 3 times a week in my clinic. The idea that movement wears joints out. It does not. Incorrect movement wears joints out, and inactivity wears joints out. The cartilage inside your joints is nourished by synovial fluid, a lubricating liquid produced by the joint lining when it receives mechanical load through movement. No movement, no synovial fluid, dry cartilage, early arthritis. That is the mechanism of osteoarthritis in sedentary people. It is not age alone that destroys joints. It is disuse. Knees. In virtually every dance tradition rooted in Latin America, the Caribbean, or West Africa, the knees never lock straight. There is a soft, yielding bend that absorbs each step. Biomechanically, this is close to to ideal. When you walk or stand with rigid, locked knees, every footfall sends impact force directly into the articular cartilage. Repeated thousands of times a day, that wears it down. When the knee yields slightly, that force transfers to the large muscles of the thigh and calf. The cartilage is protected. That is the difference between a joint that holds up for 90 years and one that is replaced at 65. Shoulders. The shoulder is the most mobile joint in the human body, capable of rotating across multiple planes. That mobility is its greatest asset and its greatest vulnerability. When you sit at a desk with your shoulders elevated and braced for 8 to 10 hours a day, the joint capsule begins to contract. The tissue thickens. The end stage of this process is adhesive capsulitis, frozen shoulder. The person literally cannot raise their arm above chest height. The shoulder rolls and isolated shimmies found in African and Caribbean dance traditions move the shoulder through its full range of motion on a regular basis. That is preventive physical therapy delivered through rhythm. Hips. The iliopsoas muscle runs from the lumbar vertebrae through the pelvis and attaches to the femur. In virtually every adult who sits for a living, it is chronically shortened and in low-grade spasm. When the iliopsoas is tight, it pulls the lumbar spine forward, creating constant compressive stress on the lower back. I had a patient, Nauert. I will call him Richard, 58 years old. Software engineer, 6 years of persistent lower back pain, 2 rounds of physical therapy, regular chiropractic care. He walked into my office and I asked him one question: when did you last rotate your hips freely? He had no answer, and hip restriction does not stop at the lower back. The pelvic floor muscles, the hammock of tissue supporting the bladder, bowel, and reproductive organs, are directly connected to the iliopsoas and internal hip rotators. When the entire pelvic complex is chronically tense and immobile, the downstream effects are wide. Bladder urgency, constipation. In women, painful menstruation. In men, chronic pelvic pain that frequently gets misdiagnosed as prostatitis when the actual problem is myofascial pelvic syndrome, muscle tension, not infection. Regular hip rotation addresses all of these structures gradually and gently, without surgery, without injections, without a prescription. Cardiovascular. A study published in PLOS 1 by researchers at Northeastern University found that free-form dance movement meets the American Heart Association's guidelines for cardiovascular health. 150 minutes of moderate intensity activity per week. No joint impact of running, no monotony of the elliptical machine, and critically, people actually sustain it. Compliance is not a small variable in medicine. The best intervention is the one the patient will actually do consistently. Bone density, rhythmic, weight-bearing movement across varied directions and tempos stimulates osteoblasts, the cells responsible for building bone tissue. Your bones respond to mechanical stress by increasing mineral density. Research shows regular dance activity can slow bone density decline by 20 to 30% for women approaching or past menopause, and for men over 60, that is not a marginal benefit. That is the difference between a fall that results in a fracture and one you walk away from. Muscles. The wide stance, slow weight shift movement found across dozens of dance traditions produces isometric loading of the quadriceps and hip abductors, sustained tension without rapid muscle shortening. This is particularly valuable for people who have been deconditioned for years because the injury risk is low while the functional strength gains are real. And strong thigh muscles are the primary venous pump for the lower legs. They push blood back up toward the heart against gravity. Weak thighs mean poor venous return, pooling blood, varicose veins, swollen ankles, chronic leg fatigue. Strong thighs mean better circulation, lower clot risk, and improved cardiovascular efficiency. Now let us talk about what is happening in the brain chemistry, not the structural neuroscience which we have covered, but the biochemistry of mood. When you dance to rhythmic music, your brain simultaneously releases dopamine, serotonin, and endorphins. Dopamine drives motivation and reward, the signal that makes you want to do something again. Serotonin regulates emotional stability. Low serotonin is directly associated with depression and anxiety. Endorphins are the brain's internally produced pain-reducing compounds, responsible for the euphoria people describe after intense physical activity. This is the same neurochemical combination that antidepressants are specifically designed to approximate. The difference is that antidepressants come with side effects, tolerance development, and discontinuation syndromes. Dancing produces the same neurochemical outcome through a pathway the brain recognizes as entirely natural. A single dance session reduces circulating cortisol, the primary stress hormone, by 25 to 40%. This matters clinically. Chronically elevated cortisol damages neurons in the hippocampus, the region most responsible for memory formation and retrieval. It also suppresses immune function. Reducing cortisol is not a wellness trend. It is direct neuroprotection. It is measurable immune support. Australian researchers confirmed that dancing restores psychological health and cognitive function more effectively than any other form of physical activity tested in both younger and older adult populations. And York University published research showing that patients with Parkinson's disease showed measurable improvements in concentration, memory, and daily functional performance when they danced regularly, even as the underlying disease continued to progress. This points to something neurologists call neural reserve, additional cognitive capacity, a buffer so that even as the brain sustains damage, it can continue to function because it had more to lose before performance degraded. Dance movement therapy is now formally recognized as a clinical psychotherapy modality across the United States and Europe. It is used in treatment protocols for major depression, generalized anxiety disorder, post-traumatic stress disorder, and neurodegenerative disease. This is not alternative medicine. This is evidence-based clinical practice. After age 45, the rate at which neuroplasticity declines begins to accelerate. After 60, that decline becomes steeper. This is not inevitable. It is a trajectory that can be altered, and it is precisely at this stage of life when learning new, unfamiliar, coordinately complex movements becomes most critical. New motor patterns at 50 are not just exercise. They are a direct intervention against cognitive aging. Here is what I want you to actually do after this video. First, start dancing for 10 to 15 minutes every day, not at a studio, not with a partner, in your living room by yourself to music you actually enjoy. 10 minutes is enough to trigger every mechanism I described today. The barrier to entry is zero. No equipment, no membership, no commute. Second, every session, try at least one movement you have not done before. The neurological benefit of dancing comes almost entirely from novelty. Once a movement becomes automatic, its impact on neuroplasticity drops significantly. The learning is the therapy. Keep pushing your edge. Third, aim for smoothness, not speed. Slow, controlled, fluid movement demands more from your cerebellum, activates more deep stabilizer muscles, and produces more genuine neuromuscular training than fast, imprecise movement. When you move slowly, there is no momentum helping you. Every inch of that motion is pure muscular work. Fourth, identify your restricted side and work it. If one hip rotates less freely than the other, that asymmetry is a clinical finding. Work into that stiffness, not aggressively, but persistently. That is where your body is compensating, loading unevenly, and building toward pain. That is where the actual rehabilitation needs to happen. Fifth, let go of rigid control. When you allow your body to move with genuine freedom, the deep stabilizers of the spine and pelvis engage spontaneously. These are muscles that do not fire in routine daily movement. They need unpredictability to activate. Free movement is their training stimulus. 5 minutes of dancing does more for your spine than a bottle of anti-inflammatories. 20 minutes does more for your mood than a lot of what gets prescribed for mild to moderate anxiety. 30 minutes 3 times a week does more for your long-term cognitive health than most supplements currently on the market combined. The system is not going to tell you this. It profits when you fill a prescription, not when you learn to salsa in your kitchen on a Tuesday night. I have spent years watching patients pay significant money for outcomes they could have prevented. That is not a criticism of patients. It is a criticism of a structure that is financially organized around treating illness rather than building health. Share this video with someone who needs to hear it today. Subscribe if you want real, evidence-based information from a practicing physician. No fluff, no sponsorships, no agenda, except getting you accurate information. I will keep making these as long as you keep watching.